Hi, good afternoon. My name is Catherine Murphy. I'm the My Health Event Coordinator at the Providence VA. As you all know, they have changed the way that we sign into My Health Event. And I'm the one person in Providence and the CBOC that can help you. So I try to teach people how to do it. But if anyone doesn't know what My Health Event is, it's your patient portal. So these are the things, some of the things that you can do. You can refill your prescriptions, communicate with your VA healthcare teams via secure message, view your appointments. You can use the Blue Button report to view your lab results, VA notes, radiology, images, reports, medication lists, and much more. And to get to all that, you have to be able to sign in. So the powers that be has decided that the old username and password, not secure enough. So they've come up with a different way of signing in. So now you have to use a sign-in partner, either login.gov or ID.me. You don't need both, you only need one. And that's where the problems come in, because it's not as easy as they say it is. So the partners are login.gov. You create your account using your email. You confirm your email, you create your password, add your phone number, and start the ID proofing. The ID proofing is where people get tripped up.
Oh, yeah.
I've
I've been there and I slammed it shut and I said, go away.
Yeah, I hear that all the time. And ID.me is a little different. You create your account, you put your email in, you create your password. It sends you an email to confirm it, you add your phone number, and then you start your ID proofing. Now, people say one better than the other. I have no idea until we start the process, to be quite honest, because I don't know what we're running into.
They have the same thing in common, neither one works.
Not easily.
I heard ID.me is going to kind of go by the wayside.
I have not heard that.
Okay.
No, I've heard rumblings about login.gov having problems and being problematic, and then they may start talking about that going away, but it's all rumor right now. And I haven't heard anything formal.
Yeah, when I went through that, when it got to start your ID proofing, they were like, okay, scan this in and then send this to me and we can do it just a few minutes over the internet, and that's when I slammed it shut.
If nothing goes wrong, you're done in 5 minutes.
But I don't even know how to scan it in and get it there.
That's where I come in. I can help you. All right, so issues you may encounter. Picture quality must be clear. No shine or glare from lights. Must have all edges of state issued ID visible. So that means don't cut any piece of it off. No corner, nothing. You have to have the whole thing visible. And it's best to use a dark background. All right, phone numbers. Another problem is the phone number can't be matched to the public record. So ultimately, on both of them, near the end of the process, it will say, verify your phone number. If it cannot match your name to public records to that phone number, then it's going to fail.
What if it's already in the VA system?
Nope, that's not what it's looking at. Yep. It's looking at public,
Yeah.
all the public information. So if you have a phone number through the internet, that's a stop right there. They do not allow phone numbers through the internet, through your computer. If you have a phone that is not through a major carrier directly, like it's a third party type thing, or it's one of those track phones, it's not going to find your name connected to the phone number. So it's going to fail.
So if you have, R&B has the correct phone number, is that validation enough?
No.
What else do they want? My first
It's
one.
it's looking at the public records. So whatever's available to public records. So if your phone number is not like with a major carrier like Verizon, AT&T, T-Mobile, it's not, it has to be directly.
Okay, so T-Mobile has my correct number.
Then you should not have no problem.
Yeah.
Yeah,
Okay,
as long as it's not a third party
yeah,
connection,
okay.
all right?
Yeah.
So if there is problems, ID.me, you have the option of a video call. So that's a good thing. And login.gov, if the phone number fails, then you have the option of doing, requesting a letter to be mailed to you. And then once it comes to you, you just go to secure.login.gov, and it will ask for that, I think it's an 8-digit code in the letter. You put that in and it finishes the verification. But the trick is, once you request a letter, you can't change the password for login.gov. You just gotta leave it alone until the letter comes. And I help with all this. If you're computer savvy, I can do it over the phone. If you have an iPhone, we can do a FaceTime thing. You can point your phone to your screen that you're using. So I have a lot of little tricks that we can
Yeah, well, I'll tell you one trick that I didn't care for. They must think that everybody's trying to log into this at 30 years old, because they wanted my photo ID or my driver's license on both sides.
Yes,
And if your hands are shaking a little bit, I ended up doing the thing 4 times.
yes,
So they finally accepted it.
yes. I agree. It's not a simple process. But we have it and we're just trying to get through the best we can. And that's where I come in. I come down to Hyannis, when need be. I go to the New Bedford CBOC, I go to the Middletown CBOC. I have at least 5 or 6 people a day coming to me in Providence. So I've been doing this, helping people for over a year to get this done. So we're down below 2,000 people that have accounts that need to switch over to this. So this is what you do when ID proofing fails. So I touched upon that with ID.me, you need your state ID or your license, and then 2 secondary IDs, which can be your Medicare card if you have it, or a health insurance card. It can be your birth certificate, it can be your social security card, it can be your VA issued ID. There's a whole list of things that it can be. And then you just take pictures, we upload it, and then we do a video call with ID.me. For login.gov, the only way to do it is either requesting a letter or telling you have to go to the post office. But I'm hearing iffy reports whether or not the post office knows what to do once you show up.
Yeah, they probably didn't know.
Right. So there are YouTube videos.
Yeah.
So if you go to YouTube and you search creating an account, it will give you a video on how to create an account for either login.gov or ID.me. Okay, you do create an account for ID.me, it will give you that video. Create an account for login.gov, it will give you that video. And then you do verifying your ID for login.gov, it will give you that video on the steps. So at least you have a visual of what to do. All right, and same thing with ID.me. You search on YouTube, verify my account for ID.me, and it will give the video. If you're giving your email addresses, I will send you these links. So all you have to do is click on it and you can view the videos. Okay? I will do almost anything to help you ladies and gentlemen, to get onto your MyHomeDebt account so you can get back to using it again. Questions, which is, you've been giving me questions all along, so that's great.
So I've had ID.me for a couple of years now, so am I good to go?
What did you create it for? Was it for Social Security? Was it for VA?
It was probably for social security.
So here's the thing. The federal government has decided, or SSA has decided, that they do their own ID for ID.me or login.gov. And it doesn't carry over, which doesn't make sense to me. I thought, and I was told when it first started, that it would carry over to other government sites, but I quickly learned that's not true. So if you create a sign-in partner for VA, you're gonna have to do the same, another ID proofing for, SSA,
It's easier. Okay.
so.
For any other government agency, like, I signed up as a volunteer in Long Beach. My daughter lives near the VA hospital. That was all login.gov.
Yeah.
Going through fingerprinting and all that stuff, but then for help my healthy vet, it's ID.
It's ID that we all log
It
in.
all works, once you're signed in, they all work.
Yeah, once you get through the process.
Yeah.
The difficulty is getting through the process sometimes. So. Any other questions?
Yeah. This is, the problems occur usually just the first time,
Yes,
and you're trying to get
right,
a lot.
yeah,
Not each time.
not each time. No, this is a one-time, once we get you through the ID proofing, that's it, that's all you have to do. There's a caveat with login.gov. It gives you a 16-character code. It's a personal key. If you have to change your password for login.gov, you must have that personal key. So I always write it down or take a screenshot of it and I tell you to keep it in a safe place. Remember where it is because you're gonna need it if you change your password. If you change your password without it, you'll be able to do it. You'll just have to go through the ID again. Yeah, but ID.me doesn't force you to do that. You can change your password anytime you want with ID.me without losing your ID proof. But I'm gonna stay here today after this presentation. If anyone wants help doing this, I will absolutely help you get through it.
Let me ask you a question. When they wrote this thing, did anybody conduct any focus groups like I do in the real world?
I did not hear that they did that.
Yeah,
I agree with you. They set this up for the younger crowd
yeah.
and not for the older crowd that has not kept up with, technology.
I just signed up. I just got accepted into the VA system. I still haven't gone down to IANS to get an ID card or anything. Do I have to do that first?
No, Mondays and Wednesdays, just drive down to the clinic, ask for Brian to volunteer between 9 AM and noon. He'll take your photo right there, you get it in the mail in 2 weeks.
Oh, just sit down and walk in.
I walk in Monday, Wednesday, only 9 to noon. Everything in your VA medical link is gonna be your name and last four of your social. You see Brian, that's what he's gonna ask you for.
Right.
Verify you're in the system, they'll take your picture and you get it in the mail in 2 weeks. 9 AM to noon,
9 noon?
that's it.
Have you guys signed your primary care doctor yet?
No.
Do you want?
Oh, yeah, I have lots of questions. I've been here for a long time, so I have all kinds of doctors. So I'm actually going to find out what to do.
So here's the great thing about the VA, if you have medication on the outside that's expensive, the most you're gonna pay at VA, I think it's like, there's 3 tiers. So tier 1 is $5 for 30 days. Tier 2 is $8 and tier 3 is 11.
Sure beats 400.
Yeah. So, but you do need a VA primary care doctor to convert the scripts from private to
Yeah,
VA.
that's what I have to do.
Yes.
Anything you need VA medical locally, just call me. I know all down there.
How does this go?
Yeah, my car.
Insurance, everyone.
Doesn't conflict.
Oh,
with
that's
the-
what, Alan's a good man, he'll call you back.
So what the VA does, so you come to the VA, we put a claim in to get reimbursed, and that just adds to our budget, so we can do all the different social outreaches and everything, and all the different programs that we have running.
So, I go to my doctor and he does prescription. Normally we send it to the rehab Stop and Shop.
You can request it to be sent to Stop and Shop, I believe, right?
What you need to do if you want to get your medications through the VA, whoever doctor that you're getting medications from currently, you're going to request what's called a desk copy of your medications. You're going to bring that with you to the IANS VA clinic, show that to your primary care doctor, and say, hey, doc, can I get these through the VA? Then they write the consult, and they'll take it from there, the UPS into your house.
Yeah, you don't have to go through Stop and Shop.
No.
That is the VA is going to cheaper.
So the doctor would send this, would order it through.
Everything in your VA medical life funnels through your VA primary care doctor. They don't write the consult. But you gotta get the desk copy of the medications first, which is your right for any medical provider that you have. And then you can weigh it out. Do I wanna get my meds from the VA? You wanna get them through? It doesn't matter. You can have both.
Yep, and if you do bring a script from the outside and you need a progress note explaining why they feel you need to be on that medication. It's just for, counting purposes on our side. So we're not just like Harry writing scripts for everyone, left and right. So you do need a medical reason for, that prescription.
But that's why you wanna get assigned your VA primary care doctor and bring all these questions with you. That is their job, to help you navigate through that. I've been using the VA medical for 18 years, even though I'm a VA employee. I get my care there too. So that's why I know, I've gone through the whole thing we're talking about, it wouldn't be myself.
Yeah, you weigh what's gonna be best for you. I know a lot of veterans that have both the private, primary care and the VA. Because sometimes the medication that they get, or maybe something they need to do is going to be cheaper for them, at the VA. Especially if it's a service connected, issue. You want that being taken care of through the VA, because it's gonna be 100% free for you.
Once you get enrolled in VA medical, you're gonna find out what VA priority group that you're in, 1 through 8, based on your time in service, based on your income, based on your disability. That's gonna make a determination if you're a copay or you don't. So for me, as an example, I'm a 50% disabled Marine Corps veteran. If you're 50% service connected, you'll never have a copay at the VA. Everything is free. So there's all these little caveats and tidbits and stuff like that. Everyone here is gonna get a follow-up email from me anyway, as long as you gave your email to them. In that's gonna be welcome kit with all fact-based information. So any of the questions that you have on this stuff, I'm happy to follow up with you. Yeah, I'll add those. Yep.
That way
So
we don't
what
have.
if I had to go to, I've been in a hospital? And that's under my insurance.
Mhm.
Now, how would the VA come in on this?
Two separate entities. If you're using your outside doctor, that's your outside doctor. If you want to get care in our community here locally, again, it would have to go through your primary care doctor. They would have to write a consult to community care, and then community care would see if there's a vendor that's vendorized by the VA, a medical facility in Eastham or Provincetown or Wellfleet. They would have to approve your visit to the outside providers locally. So that's another thing to bring up with your primary care doctor.
Well, here's one incident, in my eye, I go to OCS, or OCB. And I asked him, I said, you know, I can get my eyeglasses to the VA. He said, well, if you do that, we won't have anything to do with it. You strictly with the VA. So I can't use the both of them.
Well, potentially you could if they're vendorized with the VA. That's the whole thing we need to find out. And that's, again, will all funnel through your primary care.
Yes, it sounds like the first step is to go down my hands.
Correct.
Okay.
Yeah, you shouldn't be penalized if you live in Provincetown or Nebraska or whatever. There still should be medical services for a veteran no matter where he lives. That's the premise behind community care.
Well, I've got a VA card because I got hearing aids
Yeah.
to the VA, so I'm registered.
Right, but are you assigned a primary care doctor? Have you been assigned a primary care doctor?
No.
That's something we can easily help. You should. All we ask is you get seen once a year, and then you can decide. You want to get glasses for the VA, hearing aids for the VA, whatever the case may be. That's it.
Yeah, and the audiology and the optometry, you don't need, the primary care doctor. You can just go there. You can call for an appointment. It used to be you needed a consult, but you don't need a consult with them anymore.
Well, you could, so I could put down and get glasses.
Yep,
But I asked how, we'll have to go to doctor.
they have optometry at Hyannis. Yep. Yep, so you just go to, Hyannis and tell them you want an appointment for optometry or you want an appointment for audiology.
Oh, yeah.
If everybody wants to write this phone number down, it'll make life a lot easier for all of us. The VA developed what's called the patient call center. And the phone number is 401. 401? Yep, 401-457-3336. So it doesn't matter what it is. You want to cancel an appointment, reschedule an appointment, get a message to your provider. It doesn't matter. It's gonna go through the patient call center. They're gonna send a message to Hyannis, get you scheduled, get the primary care doctor to reach back out to you. That is the only number you will need in your VA medical life, as long as you're enrolled in the Hyannis Providence VA Healthcare System. That's it. Don't Google any numbers, don't Google Hyannis Clinic, and you'll just get rerouted anyway. Keep that phone number in that phone number.
If you do that on that.
Yep, 401-457-3336. It's gonna be your name and the last 4 of your social, just like we talked about. Anything.
You can call up and say, hey, I want to be assigned to a primary care doctor in
Exactly.
Hyannis.
Exactly.
And they'll move back to the proper person in Hyannis, and then you'll get a phone call to schedule your first appointment. Your first appointment is an hour. So be prepared, write all your questions down, bring all your prescriptions that you want to be shifted over to
The
VA.
desk copy.
I'm gonna be in
Yep.
Hyannis tomorrow morning, I should run over and see. Was it Brian?
Brian, he's wonderful.
Okay,
It's Wednesday, so you can do it.
good.
Does New Bedford still do your radiology?
They do.
I got a question.
Sure.
I mean, I'm just a happy guy, retired, 31 years retired from the military. I don't go to high. I came here, I started with RT Health and Wellesley. Everything gets done through them, through the paperwork. I mean, I got TRICARE for life now. That might mean something.
Well, that's why.
Yeah.
Well, you don't need, because you have track.
But I need a,
Well, one thing track here does not cover is hearing aids.
huh?
Hearing aids are $8,000-9,000. Exactly. You get a hearing aids for VA.
Okay, I'm just wondering, it's like, I think I'm finding missing, I don't think I'm missing nothing. I'm happy with everything's the way it's going.
But in order to use the audiology, if you ever need hearing aids, you have to be enrolled in VA. You don't have to have a primary care doctor, but you have to be enrolled.
Do you have hearing issues?
Say what?
Do you have hearing? You have a disability for your hearing.
A disability? No, I don't have a disability.
Okay. What were you in the Air Force?
30 years.
Okay. So you might have some hearing tinnitus, that type of thing. So you could put in a disability claim.
No disability. You're perfect.
Even better, then you don't need it.
And if you're enrolled in VA and you have a health emergency, and I mean, obviously you can't be brought to the VA Providence ER, so you go to the local ER, you tell them, I'm a veteran, I'm seen by the VA, please tell them I'm here. And I believe they pick up the tab.
So you gotta report it within 72 hours, and it has to be an emergency.
Yeah.
Whatever that.
You can't just carry say, oh,
Yeah.
right, that's still, and I've seen that happen. Someone needed their med still, they came in under the guise of a heart attack, and they're like, nope, I'm fine. I just need my med still.
One of the things about VA medical that I want to mention, and most veterans will know, is that the VA is partnered with a bunch of urgent care local facilities, all right? So in that follow-up email you'll get from me, we have this awesome thing called a locator. Click on the locator, hit the drop-down box that urgent care, put in your East Ham zip code. It's gonna tell you which local urgent care is vendorized through the VA, okay? You get sick on the weekends and the VA clinic in Hyannis is closed, you shouldn't be penalized. Right?
Get 3 free a year.
Yeah. So these are all the new things that are coming up. I've been there 15 years. There's been so many changes in a good way, but what good is it if no one knows? Right. That's why we do the community events.
The urgent care is especially great if you happen to discover a deer tick bite, the little bullseye, and it's a Saturday.
Yeah.
You can't go to your primary care till Monday, and you wanna take care of it right away, you go to look up what urgent care facility is covered by the VA.
So what if you call an ambulance, take it to the hospital?
If it's a true emergency, if it's a truly, I gotta get to the hospital, I'm not gonna make it. You tell them, or someone tells them that you're a veteran, that you're seen by the VA, and the VA will, that.
And this is exactly why you need to see your primary care doctor to get all these questions answered in advance.
Yeah.
Urgent care, 72-hour window, all these different things. That's what their job is to lay it all out for you, make it as easy as they can. So you're not going to learn for everything. You know what I mean? And be like, boom, this is what I do, this is who I call, go home. Right now. That's the way it should be.
And Providence wants to get this information out to veterans. Not all VAs are so open in telling their veterans what's out there for them. For some reason, it's a mystery. And Providence has been working on undoing that mystery and letting you guys know what's available.
You know, it may not be within your province, but you might want to pass this on to your province. There's a communication gap here. I'll give you an example. About 2 years ago, I had to go to Cape Cod Hospital for an emergency. They had none of my medical records, rightly so, none of my prescription information. There's no way for them to contact Stevens Place by phone.
That's why I gave you our phone number. That's the phone number I'm talking about. You don't need the Stevens phone. That phone number that I just gave everyone, that is their job to triage calls. You need that phone number, John. Put it in your phone. You're never gonna call it with it.
24/7.
401-457-3336 is the VA patient call center.
Okay, that is my point was, there's a video call center, how do they notify the people that have my records? Does it happen
So-
immediately?
So there's something called VE, and there's a visit or regional person that's in charge of this. And what happens is that person's job, and I've lost track of who it is at this point because it's changed so many times. But VE is the Veterans Information Health Exchange. So what that is a program that outside private entities can partner with VA, and that gives them the free flow of information for them to look at our records and for us to look at their records. But not every community entity is partnered with us.
So
So
apparently,
some are, some aren't.
apparently that document is either wasn't communicated to their doctors or Cape Cod Hospital was not a partner list. Because you
Right.
couldn't get any information. 2 hours we waited there, and fortunately, doctor was real smart and figured out what med I needed. Never got any information from the VA because couldn't communicate directly.
Well, yeah, and that's especially on the weekend, you're not gonna,
It wasn't a weekend.
oh, it wasn't.
What I'm saying is,
It's during the
what I'm
day.
saying is I can understand why general patients and population can't call Stevens Place directly. I understand that. But a hospital should be able to get hold of them.
So-
A hotline or something.
So if it was during the week, during the day, all they needed to do was call the, release of information people at the VA. And they would have been able to send over your information. So why they didn't do that, I don't know.
Yeah, either why.
So it shouldn't have taken 2 hours.
Maybe we need to educate the doctors.
Because our release of information people would prioritize the information to get to the emergency room over anything else. Because I mean, it's the line. So I don't know why, if it was between the hours of 7 and 5, they should have been able to get those records for you.
And if it's not between the hours of 7 and 5, call the 401-457-3336. It doesn't matter what it is.
Right.
Call that number.
They'll be able to tell with what your medication list is, at the very least, what your problem list is, at the very least. I don't know if they'd be able to, like, beyond that, but that would be a start, like.
But they're gonna get a message to your provider too. So
Right.
that's the other part.
Yep, that is.
Yes. So Catherine's gonna be here for a bit to meet with, veterans individually to set up their My Healthy Vet. We're gonna transition over to the Vet Center program. and talk about, that program next, all right? It's yours.
Yeah, so in a lot of these, we had to do things, I went and I talked with this woman, she's actually. In our attention.
Go forward. Okay, go back. Just make sure, okay, you're all set.
All set? All right, guys, we're ready for the next part of the presentation. So my name's Adam Doppler. I'm the Veterans Outreach Program Specialist at the Cape Cod Vet Center in Hyannis. This is my coworker, Donna Scaglione. She is a licensed social worker at the Vet Center. So does everyone know what the Vet Center is? Has everyone heard of the Vet Center before? Okay.
In Hyannis.
Yep, so just a quick background on the Vet Center program. The Vet Center program was started in 1979 by a triple amputee Vietnam combat veteran. He lost 3 limbs in Vietnam. His name was Max Cleland. And Senator Cleland went to the VA to get some help with PTSD, and they said, we don't do that here. Ridiculous. So he took it real personal and ended up becoming the senator of Georgia. And in 1979, President Carter and Senator Cleland wrote the legislation on the Vet Center program, a community-based PTSD mental health clinic for combat veterans, active duty soldiers, military sexual trauma, and drone operators, okay? Our mission is to welcome home and honor those who served, those still serving and their families, be reaching out to them, engage in their communities and providing them with quality readjustment counseling and timely referral. So we are VA federal employees, just like Captain. We are not at the big brick and mortar VA, we are right here in the community. I am your local point of contact as the outreach coordinator. So it doesn't matter what it is. VA healthcare, GI Bill, burial, it doesn't matter. I have all the information up to date. These are the services that we provide: counseling, referrals, and community engagement. Want to expound on some of the counseling?
Yeah, so I am one of 4 counselors at the Vet Center. We have one person, our director, she specializes in couples counseling. So she'll see a veteran in their apartment. The rest of us, we mainly focus on veterans who are having difficulties with PTSD, trauma, processing trauma. We frequently will see Vietnam veterans come to us like later in life because they came back from war, went to school, married, they're very busy, they were involved in their jobs, they retire, and then now they have time on their hands and frequently they'll start experiencing intrusive memories, they'll start remembering their trauma. So it's not unusual for someone who's been out of the military for 40, 50 years to come to us for services. And we welcome that. We also see, as Adam said, people who are currently serving. So for example, we see a lot of folks from Joint Base Cape Cod who are involved with the 102nd Intel Unit and whose job, at least in the past, has been operating drones in support of combat operations in Afghanistan and Iraq. So we see folks one-on-one, and we have groups. We have at least a half dozen groups. Some are very focused on a particular era. So we have a Vietnam veterans group. We're about to start a group for Gulf War vets and veterans who served in Iraq and Afghanistan. We have a stress management group. You know, we have a substance use disorder group. And what we try to do, in addition to offering those one-on-one services and specialized groups, is we create an atmosphere of connection. Because one of the things that trauma does is interrupt connection among human beings. Trauma breaks that connection. Trauma can impact a veteran to the point where they can isolate, they get separate from the rest of the world. And so in addition to offering specialized services to help people process their trauma, is we create an atmosphere of connection. We have a very welcoming lobby, we have coffee, people can come in and hang out if they want to, and we have events that bring veterans together. We have fishing trips. We took veterans a couple of years ago to the Bruins game. We have a nonprofit arm that helps us raise money so we can have those kinds of things.
Don't forget the barbecues.
In the barbecue, thanks, John. In the summertime, we have a barbecue at Santee Neck Beach. People really seem to like. So in addition to professional mental health counseling, we create that atmosphere of connection for folks.
Referrals. So on the Cape, you have federal, state and town, and then nonprofit. We have our friends here today from the Cape and Islands Veterans Outreach Center. They do a ton of great stuff here, and I know they've done other programs here. So it's a little bit confusing. Who do I call? Who does what, this and that? Our job is to make it as simple as we can. First of all, these are earned benefits, not given. So we want to make sure, whether you served 50 years ago or last week, it doesn't matter. We want to make sure you're getting to the right people, et cetera. So I have the list literally of every organization on Cape, and they've been at the VA locally for 15 years. I'm also a Cape Cod kid. I went to Barnstable High. I graduated from 4Cs. So I take it real personal because I'm from here, just like Peter did, just like Donna. Donna touched on the different types of counseling that we offer. We'll talk about some of the symptoms.
Yeah, so with PTSD, you know, some people talk about feeling like different from other people, separate from other people. They've experienced, for some veterans, they've seen the worst of humanity. They've seen the worst of what people are capable of. And it's hard to shake those memories, right? Those memories just don't go away. And so for some folks, they can develop a view of the world that's very negative, a view of themselves that's negative. They can lose faith in humanity. They can lose their sense of optimism. They can experience nightmares, intrusive memories. They can smell, for some people, particularly veterans in Iraq, they smell, for some people, they smell wood burning, or they smell diesel, brings them back to the combat fear. And it can be very, very disruptive. And so what we try to encourage people to understand is the trauma reaction that they experience is a normal reaction to an extreme situation, right? And so, as I said before, these things can come up at different times in people's lives. Maybe they've gone along, things have been fine, but then there's some significant stressors in their lives, some very significant changes that they don't like. That can exacerbate symptoms of PTSD. The other thing that we see a lot of is folks, men and women, who have experienced military sexual trauma. They've been sexually assaulted by people they serve with. They may have experienced some significant sexual harassment. We specialize in that. We have special training in managing that. The transitions from military to civilian life, that's a very difficult one, particularly for some of the folks who came back from Iran and Afghanistan. They have young families. They go from a combat theater to being on Cape Cod, and very, very different environment, very, very different expectations that they have of themselves and family members compared to when they were serving. So we're called readjustment counselors at the Vet Center. We help people readjust to civilian life. And then of course, you know, some people come in, it's not about their war experience, not about military sexual trauma. They're experiencing depression and anxiety from things that are happening every day. Maybe they have caregiver issues. Maybe they're stressed as the primary caregiver for a partner. We see a lot of that in some of our older vets, and that's something that we help people with. And then of course we offer bereavement services for family members. Well, one thing I want to stress too is I work out of the Hyannis office with Adam, but I also come to Provincetown 1 day a month, and I see veterans at the COA program up there. So if anyone's interested in counseling services, and you live down this way, I can see you in Provincetown.
Qualities of the Vet Center, like I said, we are not the big brick and mortar, we're right here in your local community. We have free Wi-Fi, so some veterans like to come in, hang out, read the newspaper. It doesn't always have to be about counseling all the time. Donna works locally, and they started this great program called Guitar for Vets as well. You want to talk about it?
Oh, yeah. Yeah, so there is a national organization called Guitars for Vets. They are separate from us. They're a separate nonprofit, but they have local chapters throughout the country. And their local coordinator contacted us and asked to partner with us to offer their program. And so what that is for people who are eligible for Vet Center services, they are eligible for Guitars for Vets. So we connect you to a professional instructor for 10 lessons with the guitar. They supply the guitar. And at the end of 10 sessions, you get a beautiful free acoustic guitar. And you can see the instructor on a weekly basis, bi-weekly basis, whatever works. And you come and you get the lesson at the Vet Center. So we've had pretty close to a dozen veterans do that by now. And we've seen veterans engage in it with absolutely no guitar experience on up to folks who, you know, have been playing right along, but they just wanted to kick up their expertise a little bit. So we have instructors that can accommodate either level of expert.
You get a free guitar, right?
They get free guitar.
Pretty cool. So again, this is a free and confidential services. You know, a lot of times with, you know, insurances and whatnot, they might take only so many mental health appointments. That is not applicable to us at all. Also, you do not have to be enrolled in VA healthcare to be eligible for Vet Center services, as long as you meet our eligibility criteria. Referrals, what I've tried to do is the one-stop shopping model. You guys live in Eastham. When you come up there, I want to make sure that it's worth the drive, right? So I'm going to provide you information on all up-to-date medical services, disability services, VA claim services, so on and so forth. So has anyone heard the term VERA before? V-E-R-A. So this is one of the best programs the VA has ever initiated, and it all stemmed from COVID. So what happened was veterans who were filing disabilities and claims could not get into regional benefit offices because of COVID. They closed the buildings. So some genius came up with this idea called VERA, Visitor Engagement Reporting Application. So through the VERA system, you can literally call my office this week and say, hey, Adam, I want to schedule an appointment to file a disability or a claim. I schedule appointments on Tuesdays and Thursdays at my office with this little iPad. Veteran comes in, says, I want to put in a claim for my hearing, my back, my knee, it doesn't matter. The subject matter expert on the other side of the iPad types up all of the paperwork for you, does everything for you. Emails it back to me, I fill it out, all your contentions are listed, and your claim is filed. This is an incredible service right here that we offer in Hyannis. You have questions about your disability pay, right? I didn't get it on time, or whatever the case may be, I need a copy of my current service connection letter for my property tax exemption. Whatever the case may be, I can schedule a Vera phone call tomorrow. They'll email it to me and I'll print it out. So an incredible service, and this will be part of the follow-up email that you'll get as well. So we're covering the medical side of things, the mental health side of things, disability side of things, nonprofit side of things, all kind of in one shot. So again, like I talked about earlier, it doesn't matter if you live in Eastham or Hawaii, you should be able to get the same benefits and programs that you earn. These are the 7 locations in Massachusetts. There's our little office here in Hyannis. The call center, incredibly significant. If you call at 2 o'clock in the morning and you're struggling at 3 o'clock in the morning, doesn't matter when it is, somebody's going to answer the call, either a social worker or another veteran. So, you know, you might need to cancel your appointment with Donna tomorrow. When you call after hours, something came up in your life. Call the call center, they'll get the message to us, or walk in and get an email in the morning. So.
Or if they call us, if you call our number after hours, it rolls over to this phone number. And they're located in Colorado.
And if we're all,
They always get a message.
yeah, and if we're all too busy during the day, it will also go to the call center. So. Great thing to have.
927.
Yeah, but even on my card, if you call the 508-778-0124, they'll get rerouted to that if no one answers it. So that's kind of the Vet Center program in the nutshell. You know, we're local, we're here. You know, we're here to help. Donna's down in Provincetown too, once a month, but anytime you want to schedule on a Tuesday or Thursday, I block those days specifically to meet with veterans and community partners. Things come up all the time, you know, plus not only you guys veterans, you might have family members who are veterans who may need some kind of help. You know, we're all our best advocates helping each other. Any questions?
What's the difference between the Stevens Street address and 474 West?
So they are medical, we're mental health. They do all of your, get assigned a primary care doctor,
Stevens Street.
Stevens
Yeah.
Street. Yeah,
Oh, this is mental health. Oh,
correct.
But there is mental health at Stevens Street as well. So just to differentiate a little bit, we offer only counseling. If you want antidepressants, if you want psychiatric medication, you have to go through Stevens Street. There's a psychiatrist, what else is there? There's a prescriber, a pharmacy prescriber, nurse practitioner. That's where you would get your psychiatric medication. We are strictly counseling. And we do collaborate with them. We do consult with the psychiatric providers. Oh, let's do this thing.
Right.
Um,
A lot of veterans have both. They go in for the general, they go for mental health.
yeah. And just to differentiate a little bit in terms of the counseling care that we provide at the vet center versus VA. The vet center, we do what is considered evidence-based care, right? So like some strict treatment protocols where there's homework involved and it's 12 weeks of a particular treatment. We do that as appropriate and if a veteran is interested in that. But beyond that, we will see people in a less structured way too, right? So we meet with folks, we meet them where they are at. And we have a little bit more flexibility with how long we can see a veteran. Sometimes things are a little bit more time limited at Stevens Street, not always. So there's just we're a little bit looser at the vet center, if you will.
I've got a question. I've got a friend who served, 2 days less than 2 years. He's not considered a vet.
What year?
I can't say.
Well, if he served 1 day of active duty prior to 1980, the 24 consecutive months doesn't matter.
Is that right?
It's after 1980 is 24 consecutive.
Well, I'll be talking to him and I'll find out.
But just as a cardinal rule moving forward,
Yeah,
it doesn't matter when anyone served, have them apply anyway.
okay.
There's been so many changes in the VA in the last 5 years, more veterans are now eligible for VA healthcare. So we tell everyone to apply, active, reserve, guard, because it's not up to us to make that decision. It's up to the Department of Veterans Affairs. We just so happens we have a direct pipeline to Providence VA. Eligibility, you get the answer within 2 to 3 weeks. So just have them call me. I do it all the time. More than happy to help. You don't have to get into the minutia. When this person served, didn't serve, doesn't matter,
Okay,
just to make it easy.
thank you.
All right. Couple other things about VA healthcare. Once you're enrolled in VA healthcare, you're enrolled for life. Okay? So I don't care if you call me up 6 months from now and say, Adam, we're moving to Hawaii. Fantastic. We'll transfer you to Hawaii. Okay? Every VA has what's called a traveling nurse. When you know that you're moving, you're gonna know 3 months from now, 6 months from now. Get with your primary care doctor, they'll write the consult to the traveling nurse. Traveling nurse will get you scheduled in Hawaii. So you don't lose any continuity of care, medications, etc. So these are all these little new nuances that no one knows about.
That's also available to folks who like consider themselves snowbirds.
Exactly.
So a lot of folks that we see at the vet center and that Stephen Street sees, they go out to Florida and they can connect with, get their care transferred down there for like 3 months, 6 months, however long they're there.
You know, I was in Florida taking care of my wife's mother just before, and then starting off in COVID, and had a reoccurrence of throat cancer, vocal cord cancer. I went into the Orlando VA and bing, 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 and they said, well, you qualify as a traveling vet. Next thing you know, I'm scheduled for 9 weeks of radiation.
Yep.
That is gone. That was
So if you,
almost 4 years ago, and I'm home free so far.
So if you have like say an MRI scheduled and something happens and you happen to, you have to go away, you can tell your doctor, hey, put a traveling vet request in because I have an emergency and I'm gonna be here, and they'll schedule it, they'll coordinate it to the VA where it's gonna be. So you can still get your MRI on time.
They're amazingly great on that. I was really surprised, the traveling vet, representative.
Yeah.
Done. That's it, ready.
Yeah,
In the
so,
car.
so you had something of an emergent basis, so it wasn't something expected. So any veteran can go to a VA where they're at, register and get care. You are considered a traveling veteran, but that consult isn't really needed, or they'll put it in, whatever. But on emergent care, yeah, absolutely. But if it's something that you know you need, but you have to travel unexpectedly, you don't have to cancel your appointment just because you have to travel. So there's that too, so.
Rescheduling.
Right, because you might not get an appointment for another month.
Or two.
Yeah.
For
So,
example, if you look on I'm already registered with my health event and all this stuff, and if I download a blue, what's it called?
blue button,
The blue button, there's, I think, probably 11 VA hospitals across the country that have me as a patient.
Yep.
I mean,
So my VA doesn't just pull from your local VA, it pulls all your information from what's called a master patient index. So it's like a dumping station for every VA. So every VA, and then my VA targets your name and pulls all your information into your account. So it doesn't matter what VA, what CBOC, whatever, you're gonna have that information. If it's available through my VA, you're gonna have it.
it's just really great. Once you go through the process of getting yourself registered, that's probably the most difficult part of the whole operation.
The last thing I want to say about VA medical, dental. Only veteran that gets free healthcare with dental is if you're 100% service connected. Right? If you are not 100% service connected, but you're enrolled in VA healthcare, we do have a subsidiary called VA DIP. I have all the information on it. The caveat is to be enrolled. You can call the VA DIP number and see what the dental prices are. It might be a reduced rate. Other than that, you'd have to be service connected specifically for dental work. But those are the only two. I get a lot of questions on dental. So just something to keep in mind. A lot of veterans think, oh, no, not 100%, I don't get dental. That's not true. You can get dental, but not for free at a reduced rate. Okay. The last thing I want to say is I just want to introduce Peter and Laura from the Cape and Islands Veterans Outreach Center. They do tremendous work at this veterans nonprofit. Pete, you want to just talk about a couple of programs that you offer?
Yeah, I'll say a couple quick words. Most of you folks know who I am. This is my new colleague, Laura. Most of you know I'm here every month for the East Ham Veterans Rendezvous. There's 4 main things we do at Civiloc. First one is our food pantry. It happens every Thursday. We have a food pantry right by our office in Civiloc. We feed about 150 families every week. Right, so they line up at 8 a.m. They come and they fill out a checklist of what food they want. We give it to a volunteer. They shop that checklist, and the veteran ends up with food at the end of the day to feed their families or themselves or whoever it may be. We also do a mobile food pantry. Today they're in Falmouth, I believe, at the Elks Lodge there. We operate in Martha's Vineyard, Wareham, East Ham, and Falmouth. So we'll go around to those locations.
When are you in East Ham?
We're on East Ham. I believe it's the
Second and fourth Tuesday.
second and fourth Tuesday. Thank you very much.
Take advantage of it.
It's a great opportunity to get food. Maybe you're not food insecure, but we still serve any veteran that wants to get signed up for our food
But
bank.
you might know a veteran who is.
We get all our food from the Greater Boston Food Bank, as well as we're in partnership with some local grocery stores like Stop and Shop, things like that. So that's our food pantry aspect. Another big thing that we do is transportation. So in order to access transportation, you have to be less than 30% service connected. Okay, and transportation, maybe there's a veteran that lost a limb, or they're disabled and they can't drive, or maybe they're just too old to drive, or they can't see the road real well, what have you. We're in partnership with Uber Health, we're in partnership with Green Shuttle, and then if you have a wheelchair or a walker or a serious medical issue like that, we're in partnership with Prime Medical. So you call us, you call the transportation line, which I know a lot of you have, you call the transportation line, get hooked up with Laura. She'll help you out. She'll book the ride for you. We give rides constantly to the VA hospitals in Providence and West Roxbury, Jamaica Plain, wherever it may be. I will say, if you are over 30% service connected, I believe the VA is required to give you a ride to a VA appointment. Am I correct in saying that? Yeah, so if you're over 30% service connected and you need to go to a VA appointment, they'll facilitate that ride for you.
Or if you drive yourself, you're over 30%, you need to get enrolled with your banking information, so you can get reimbursed for your travel. Most veterans don't know if they're over 30%. They get reimbursed for their travel to the Providence VA.
Even to high end, that's from Wealthy,
Yes, as well.
Yeah.
$28.
There's a website that you can get reimbursed by. They also do it by text messaging now, so if you're enrolled in the vet text, when you accept your appointment, the next text message you'll get is to check in for your appointment, and when you say yes, it will say, do you want to start your claim? So, and then it just steps through the claim.
So yeah, that's part of our transportation piece. You know, we give rides all over. You have to live on Cape Cod, and the ride has to originate in Cape Cod. So if you're out in Worcester and you want to get a ride back to East Ham, we can't do that for you. You got to start here and end up, you know, wherever your destination is. But you got to start on Cape Cod. You got to live on Cape Cod. You know, it's no problem for you folks here. So that's our transportation and food piece. We have our outreach department, which is what I do. We have a lot of social events, as you know. We have the Veteran Rendezvous Cafe here in East Ham. Just a great way for veterans to get together, have a social hour, have some coffee and food, talk. Usually we do a little activity. Sometimes it'll be trivia. or sometimes we'll have a presentation from a different entity like the Red Cross, or Heroes in Transition, what have you. We do those at all the senior centers and the councils on aging across Cape Cod. There's usually one pretty much every week. Next week I'll be here. Week after that I'll be in Barnstable. You kind of get the idea there. I help set up a lot of the resource fairs that we do. So perhaps, I think I saw you, John, the resource fair that we just had at the Cape Cod Community College.
Yes.
In Hyannis there. So we do a lot of those resource fairs. It's just a great opportunity for veterans to get some information on the different veteran agencies that we have on Cape Cod. Great way to, you know, get some more information on any questions that you have about the VA, things like that. And then we also have counseling services that we do at Civoc. We have a great psychologist. His name is Dr. David Mishkin. He sees clients pretty much every day. He starts in the morning and he leaves around 2. But he'll do counseling services at our office for folks that want to come in. And he also does a couple meetings over Zoom every now and then. So if you want to get signed up for counseling services with us, with Dr. Mishkin, he's a great resource for a lot of the veterans. He's truly helped some of our clients. There was a guy that we had, he had lost his wife and he had a walker and he was real hunched over like this, almost nonverbal. He wasn't talking at all. And after, I want to say 3 or 4 sessions with Dr. David Mishkin, he was standing up straight with his walker and he was talking like a songbird. So it was great to see, you know, a measurable impact there. A lot of things we do, at least since I've been here, have improved and grown in attendance and just grown altogether. So it's wonderful to see some more of our veterans accessing our services at Civoc. And whenever I'm at an event like this, I try to, you know, give a little spiel about who we are and what we do. So that's the Cape and Islands Veterans Outreach Center. We're also on Stevens Street, right next to the Hyannis VA there. So if you're ever over there, come talk.
See him when you're going.
Pop in and see me. I'm there pretty much every day, so I'll be around. But that's pretty much my piece. Laura, do you have anything else to say? Any questions for me, folks?
So thank you all for your service. We really appreciate it. We're going to be here for a little bit. If you want to meet with us individually, I'm more than happy to answer your question. Thanks,
Laura.